had to have that conversation. Couldn't figure out what this lump. The story gets much funnier. She was like, okay, no worries. You know, just breathe through my contractions and think about waves.
I always saw it as something like, oh, that's gonna be cool, I'm gonna be having so much fun, and that's all how I pictured, being a mother. How did you envision motherhood, and how many kids did you want growing up?
It's funny because my mum says that she always wanted 6 children. Wow. and she ended up obviously having 6 children because I'm one of 6 kids, but I don't ever remember having those thoughts, like thinking about how many kids I was going to have. I just think that, growing up, I grew up in Sydney in Australia, sort of on Sydney's outskirts, and I had a big family and went to a small primary school, and it was just the thing that it was just expected that you get married and you have kids. So I never really thought about it much, but I just expected that that's what would happen in my future. Yeah, so Matt and I, we met a few months before I moved to Berlin, Germany for a job, and we were both living in Sydney. So I was I think I was 29 when, it must have been 29. And the conversation about kids and, getting married and things like that, it didn't really come up until... So we had talked about marriage and that we both said we wanted that in our future, but we didn't have like a set timeline or anything like that. And, we were getting settled here, we were making friends, so we weren't really so focused on it. But actually, so I went away for work. So I work as a communications advisor, and the humanitarian organization I work for has projects overseas. And I went away for work to Bangladesh, actually during the Rohingya crisis in 2017, when thousands of Rohingya refugees fled over into the border in Bangladesh to an area called Cox's Bazar. And I was there, and I had really bad abdominal pains, and I was trying to do my work at the same time, and anyway, so it was a really interesting trip. But I came back, and when I came back here, I was still feeling unwell. And I also had this lump in my groin. So this is sort of how the conversation about children came up, which is a roundabout story. But I ended up going to the doctor to get that checked out, and they couldn't figure out what this lump was in my groin, which was incredibly embarrassing because the doctor that I went to see, she couldn't speak English and I couldn't speak German. And she ended up actually calling an ambulance. The story gets much funnier. And then the ambulance came because she couldn't figure out what this lump was, and one of the sort of ambulance officers, he could speak English, and so she was getting him to have a look at the lump in my groin.
You were at a clinic, or where were you?
Yeah, I was at a clinic across the road from my apartment because I had come back a few days before from Bangladesh, and my abdominal pains had gotten a lot worse, and this lump seemed to have gotten bigger. And obviously when you come from a country where because I was working a lot in the camps in Cox's Bazar, I wasn't sure whether perhaps it was related to having picked something up there, and I communicated this to her somehow, and so she was quite concerned too that maybe I had picked something up in Bangladesh. So she called this ambulance. Wow. Because it was a Friday afternoon, and it was a long weekend coming up. I think Monday and Tuesday, for some reason it was a long weekend, and so nothing was going to be open. So she obviously thought we should get this sorted now. So this is the very, very long way of me telling you about how the conversation about kids came up, because I ended up getting taken to hospital. They did all these tests and they couldn't figure out what this lump was. And they said, look, we're going to have to operate on you, which was terrifying because, I just thought
They had to do it right away, or?
So they booked me in for the surgery for a few days later.
And they didn't know what it is at that point.
They didn't know what it was.
But they knew that it had to be removed surgically?
They just knew, like the doctor just said to me at the hospital that basically their diagnosis was they didn't have a diagnosis, they didn't know what it was, and as it was, you know, I can imagine because it's a lump in your groin and because that's usually where your glands are, they were probably concerned that it was maybe something more serious, and they wanted to, get it out and get a biopsy done. So I had this operation a few days later, which was absolutely terrifying, and then I had to wait 2 weeks for the results, and then I got the results 2 weeks later, and they sat me down and they said, look, it's nothing serious, it's benign. So my main concern was like, is it cancerous or something like that? But it's endometriosis. So that's when the lining of your uterus grows outside your uterus, and it can cause pain, but it's also the leading cause of infertility in women. So then when I got this diagnosis, of course, then, the doctor said to me, you should go speak to your gynaecologist about this, and you might want to consider having keyhole surgery so that they can see where else the endometriosis is in your body. I mean, I was happy to have the diagnosis because it meant it explained why, why I had this really bad abdominal pain and some other symptoms. So I went to the gynecologist, and the gynecologist said to me basically, if you want to have children, that's something you should really start thinking about now because it can cause issues with trying to conceive. So that's how then I went home to Matt, and then we had to have that conversation. And it was this weird thing of, actually, it was the first time where I had to really think, like, do I want kids? And obviously I decided I wanted kids, I wanted to have children with Matt. And so we really had to take it seriously, and then those sort of conversations came up.
Did you have to do then any kind of special, treatment or preparation?
So after we had the discussion about having children, no, I went for an ultrasound with a specialist in endometriosis, and she basically recommended that, she said, look, if it's the pain that you're having, if it's manageable, that her recommendation was that I don't have surgery, because obviously with surgery, there can be other complications. You can get scar tissue from the incisions too that can cause pain. So she just recommended that basically we try and fall pregnant, but if there are any issues with that after a year, that then I come back and that they would look at doing the surgery. So in terms of preparation, I just started taking some prenatal multivitamins, and then we started trying.
Right, and you had to get another surgery for...
No, so then I just went to a specialist surgeon who specialises in endometriosis, excision, and just for her to assess whether she felt that I needed to have more endometriosis tissue removed, an investigation to see where else it was, or whether she recommended that I try and wait that out and just manage the pain with, pain relief and things like that. So that's what, that visit was about. So with endometriosis, it's usually that you get pain with your period or just before your period, and it can be worse than someone who doesn't have endometriosis. And I mean, I've always had really bad, painful periods, so that's just something that I've dealt with, most of my life, and taken pain relief for. And unfortunately there's no cure for endometriosis, so it's one of those things that you just try and live with.
Okay.
Yeah.
And do you, I know nothing about it, but is it normally there's more risk in pregnancy when you have endometriosis, or?
No, so thankfully with endometriosis there's no indication that it affects pregnancy. Once you're pregnant, that there's any risks involved with the pregnancy. Usually for me, what I found anyway was that the abdominal pain that I would get with my periods and just before my periods, I didn't have that at all when I was pregnant, and I didn't have so I didn't have to take pain relief all throughout my pregnancy, which for me is was a new thing because
Wow.
usually every month, for like a week, I'm, in a lot of pain and taking
A week?
pain of,
Every month? Wow.
Yeah,
Okay.
at least, yeah.
Yeah, wow. And how long did it take for you to conceive?
Yeah, thankfully it didn't take very long. So I think, we started trying in December and I think a few months later then I was pregnant with my son. So that was a relief that it didn't take very long because, obviously there's lots of stories out there of people who, it takes quite a while.
Yeah.
So that was good. Yeah.
And how did you feel?
When I was pregnant?
Yeah.
I think I just felt like it was weird, which is strange because you grow up your whole life knowing, pregnant people. I mean, being one of 6, I can remember my mum being pregnant with my little brother and my little sister, but I just felt weird because your body's changing and it felt like this little alien is growing inside you as your stomach gets bigger and, you crave weird things and with the nausea that you get at the beginning. Yeah, so it was a weird feeling and I also felt quite anxious as well. I don't know if that was also because of the hormones too, but I felt really anxious about, that something could go wrong. And it's that weird thing, isn't it, where you can't control what's happening.
Yeah.
So it's not fun to feel, for me anyway. Maybe I'm a bit of a control freak, but I just felt like I didn't know what was going to happen. So that I found really hard to deal with.
How intense were the nausea or the morning sickness? Did you have it throughout the day or just in the morning?
I had with Frankie because I've got 2 kids now and my second one, she is now 3 months old and Frankie, my firstborn, is 2.5. But with Frankie, I had a bit of nausea, I remember, at the beginning of the pregnancy in the first trimester. But with Nia, my daughter, I found I had quite a fair bit of nausea. And because, I was working at the time and it was really busy during Corona times, where both my husband and I are working from home. And the nausea was really bad. I just, in between meetings, I would have to sometimes just lie down just so that I didn't run to the bathroom and vomit. And I had to keep trying the snack. And I think I feel like that was up until the middle of the second trimester with Nia. Yeah, and it was all day. It wasn't just in the morning, which I found so frustrating because I had some people say to me, I had one man say to me that I was trying to organise something and I sort of said, look, I've got nausea from pregnancy, and he was like, oh well, we can just do it in the evening because I heard that you could, because it's just in the morning, so we'll just right. And I was so frustrated because I was like, no, it's all day, okay, and it's all night. But and
is there anything that helped? Did you do any there remedies or anything like that? Anything helped or? Not really. I did try to do all the things that people tell you to do, like drinking ginger tea and having little snacks of dry crackers and things like that, but I just honestly didn't find that much helped. I was lucky though, it's not like I wasn't vomiting all the time. It was just, I just constant. I just felt like I was going to vomit all the time. Yeah. And you were working and you had a toddler. Yes. How did you manage? I can't just imagine. I don't know. No, look, it was okay. Thankfully, my husband, Matt, he was, really managing our toddler. And I felt a bit sad for Frankie, my son, because, I would often, on the weekends, I'd be lying on the couch and just felt like I couldn't move, and he would want to go out and play, and Matt would take him out, but he'd sort of say to me, Mummy, why aren't you coming? And, you get those feelings where you feel really guilty. Yeah. But he was okay. So, and it passed, thankfully. And then, for both pregnancies, I was lucky that there weren't any complications or anything like that. Mm-hmm. So I had pretty easy pregnancies, even though I didn't enjoy being pregnant. Mm-hmm. Can you tell me about, the cost associated with pregnancy in Berlin?
Yeah, so in Berlin, Germany, so we're lucky that we have public health insurance, and obviously that's a legal requirement here. So anyone who works a job has to pay contributions for health insurance as part of their salary. And yeah, that's great because it means that pretty much, I think all of the costs for the costs related to pregnancy, the scans, and you know, if you obviously get blood tests during that time, so they check your iron levels and things like that, it's like 90% of it is covered. We did a pregnancy birthing course.
Oh, okay.
Yeah, and so that was all about like labor and, you know, what that process is like, and if you have a vaginal birth or if you have a C-section, what's involved in that and things like that. So we did like a 2-day preparing for birth course.
What do they teach you there?
They taught the midwife, it was run by a midwife, and she taught us about, you know, contractions and how to know when to go to hospital.
Oh, okay.
And then also when you're in labour, she taught us told us about how to, your partner, if you, or your birth support partner, how they can help relieve some of your pain by doing, you know, massages and things like that. And there was like a real emphasis on trying to avoid a C-section and also having a natural medication-free birth, which now I feel like there's so much emphasis on that, but I feel like a lot of it just puts on more pressure on women. You know, I don't understand why women are being pressured to not have pain relief while giving birth. I find it really strange.
Yeah.
But that's just a feeling that I have now after giving birth. But at the time, I also was like, yes, that's a great idea. I'm going to have medication-free birth, and, you know, just breathe through my contractions and think about waves. And then my partner's going to give me massages and it's all going to be beautiful and amazing.
Yeah.
So we did that course.
When did the labor contractions, the first signs of labor begin?
With my son, it was pretty accurate, his due date. So he was actually born on his due date. And 2 days before he was born, I started getting contractions at home, and they were just light contractions that felt like period pains. So we decided to stay home for a bit and wait until the contractions were closer together, and, you know, we felt things had progressed. And so we stayed home for that day.
Yeah.
And I think we just watched, you know, TV, and it was okay. It was manageable. And then that night, at about, I think it was about 3 a.m, we were lying in bed and I was trying to sleep and I couldn't, and I felt like the pain had gotten, you know, much stronger, and that the contractions were closer together and that we should get to hospital.
How many minutes?
Yeah. I honestly, I can't remember. Yeah, I can't remember. I think I messaged my midwife, and I told her how far apart they were at the time, and she said that, it's good to go to hospital now just to get things checked out. And also, I wasn't sure if my water had broken, but I had noticed like a trickle, which turned out to be my water had broken. And so we went to the hospital in a taxi. And
in the middle of the night.
In the middle of the night. It was funny because we lived at that time within walking distance to the hospital. Yeah. But because it was 3 a.m, we would have had to walk through a big dark park. And the idea of, you know, like having horrible contractions and then walking through a dark park at night. Yeah. So we decided to get a taxi. Yeah. And we got there and I was checked out, and I think that, the midwife said that I was dilated by a centimetre. Okay. Which I was so disappointed about, because by that stage, like the pain was really strong.
But how many hours have passed since the first contractions?
Yeah, that's a good question. I think it was
a day, right?
It must have a day and half the night, right?
Okay.
Yeah.
Right. And then you dilate 1 centimeter and you had strong contractions. Yeah.
Yeah, and so the midwife just said to walk around the hospital hallways just to try and progress things. Yeah. And so we walked around the hallways, which was also funny because you see there's other women there who were also walking in the hallways having contractions, holding on to, you know, we're all like holding on to the yeah, the handrails as we're walking past each other. So that was bizarre. Yeah, so my water had broken, and then it had broken at home. My water had broken at home. But it wasn't like in the movies where like
it was just a little.
It was just like it trickled out slowly.
But at the hospital, was there more?
No, I don't remember. No, there wasn't more at the hospital.
Okay.
Yeah, and so then I was checked by another midwife about an hour later, and she said I was further dilated, so it was time to go to a room. And so yeah, we were put in a birthing room, and
so how long have you been at the hospital at that point?
At that point, that's a good question. I think that we had been there for maybe 5 or so hours, and then they said, because in between the time when they had also said to me that I could they had a bath that I could go into while I was having contractions to help with the pain relief. So sorry, I then was taken to the bath. It's all a blur now. I mean, it did not help at all. Like prior to childbirth, I was like, because whenever I had really bad period pains, I would have a bath, and I always felt like it helped.
Yeah.
So I thought, during childbirth, like I'll have a water birth, and I won't feel it. It'll just be great. Or, I won't feel it as much. And so, yeah, I was in the bath, and it was very painful. I still was having a lot of pain. Like it helped a little bit, but the contractions, I mean, they were so strong. And poor Matt was sitting there, we'd been there for quite a few hours at that point, and he had to sit there and watch me in the bath. I was like moaning in pain. Yeah, it was not the most glamorous look. I wouldn't be putting that video on Instagram if there was a video of it. But yeah, so I was moaning in pain, and then after I think an hour or so, then another midwife came and checked, and I was dilated enough that it was time to go into a birthing suite. So she took us to the birthing suite and like hooked me up to the monitors, and at that point I just told her that I wanted an epidural. And she was one of the younger midwives, and she was sort of like, okay, like, yeah, we'll come back later. And I was just like thinking, I want it now. And so basically I kept making Matt follow up with the midwives like every 10 or 15 minutes to say, she wants an epidural. She wants an epidural, because I felt like they were being
what were they waiting for? Like if you asked. Yeah, but then it could be late, right? It could be late.
Exactly.
There's a time.
Exactly. You need to be. What is it? Like you can't be further than 6 centimeters dilated, or is it? I get confused. But yeah, exactly. I knew that if I left it too long, that they might say, well, it's too late now. So Matt kept following up. My husband kept following up with the midwives to get this epidural. And then they got a new midwife on, and she was so great. She was a bit older, like she was in her maybe early 50s. And she came into the room, and I was still like moaning like a crazy person. And she said, I heard that you wanted an epidural. And I was like, yes, I want an epidural. And she was like, okay, no worries, I'll get it sorted. So she went and got the anaesthetist, and then he came in and he gave me the epidural. And as soon as I had that, I was like, it just felt so much better. And finally I could like lie on the bed and just relax a bit. I think I slept for a bit, and Matt could also finally like sit back without having to like hold my hand the whole time. Yeah. So then, we were just sitting in the room. We had like some music playing, and we felt much more relaxed about everything. And so I think by the time, so it must have been about 13 hours since we had arrived at the hospital. Then the midwife was coming in and checking, and the heart rate monitor kept going off because Frankie's heart rate was too high at the time.
High?
It was too high, yeah.
Oh, okay.
Yeah.
Beating faster.
It was
than
beating
normal.
too fast, yeah.
Okay.
Exactly. And so then they were getting a bit concerned, and because I'd been in active labour for quite a while, they gave me something, I'm not sure what it was, to slow the contractions down so that we could try and bring his heart rate down.
So when you had epidural, the contractions were still going on, but you just didn't feel the pain. right?
With the epidural, it didn't stop the feeling. Like I could still feel pressure,
Okay.
but I didn't have the pain.
How would you describe it?
The epidural.
When you're under epidural, what do you feel?
I just felt with the epidural a bit numb, I think. A bit numb from the waist down. You could still walk.
Yeah.
You wouldn't be able to run, but like you could still walk, and I could still feel the pressure, but it just took away the pain. The pain that I was having. The
sharpness of the intensity, but you could still feel sort of
things moving, and like I could still feel him, sort of the pressure of him moving, I guess, down the birth canal.
Oh, yeah. Okay. And then they did something to stop the contraction, to slow down the contractions.
Yes, they gave me something in my IV that I cannot remember that slowed down the contractions so that they could try and slow his heart rate down.
Uh-huh.
And then, so then what happened was that the monitor started going off again because his heart rate was too low.
Oh, okay.
Yeah, and then they gave me something to speed his heart rate up again. And his heart rate, then, he was in the birth canal, and I assume it would have been, I don't know, I think it would have been too late to have a C-section by that stage. So the midwife, was like, I can see the top of his head, and so it's like ready to start pushing, and the heart rate monitor was kept going off. So by that stage a doctor had been sitting in the room for probably about half an hour, because I think things are a little bit touch and go, and maybe they were wondering whether they needed to take me for a C-section. And so they got Matt to mute the heart rate monitor because it just kept going off. And then the midwife was like, I need you to start pushing. And so that's when, the pushing started. Okay. So I could feel, there was pressure there, and the midwife was directing me to push. So that started, and it honestly felt like forever. And I think it got to I'd been pushing as hard as I could, and, they were really trying to get him out, but his head was coming out a little bit, but then it seemed to be going back in, and I just couldn't get him out. So then the doctor said to me, look, I'm going to start pushing on your stomach to try and help get him out, because we need to get him out. And so the doctor was like putting her full force on me and like on my stomach to push him out, and then the midwife was standing there sort of ready to pull him out. So they ended up pushing and getting him out, and he was in distress when he came out, but he was okay.
Okay.
But he was okay. He was breathing and everything. He had meconium on him. So
what is that?
That's when the babies they pooed on themselves, basically, and it's usually an indication that they were in distress.
Oh.
Yeah.
Okay. And did you feel any pain?
I remember, because that's the other thing that the midwife did, the episiotomy, where they cut you to open things up a bit more. And I remember feeling that. So I feel like the epidural by that stage had pretty much worn off, because I could feel the scissors cutting me, and it was quite, it was quite painful. But honestly, I was just like, whatever they needed to do to get him out, I didn't really care. And then when I was holding him after the placenta had been delivered, the doctor was stitching me up, and it hurt. I felt everything. It was horrible. Like, it was really, really horrible. That was the most painful part of it. And I just remember wincing, and she was like, oh, you can feel this, because I think she just thought that the epidural would mean that I couldn't feel it, but it must have worn off by that stage. And I was like, yes, I can. And she's like, oh, I'm sorry, there's nothing I can do about it. And just had to keep stitching me up.
Oh, okay. And how did the bonding go? When did you start breastfeeding?
Yeah. So after that, it was a bit of, it just felt like a blur. So they took me up to I don't know if I did this with you too, but they put you in like a wheelchair and they take you up to the hospital room. Yeah. So they wheel you up to the hospital room with the baby. And yeah, with Frankie, I don't know, I felt like they just sort of put me in a room. I was in there, a small room with another woman, and she had just had her baby as well. And that was it. Like there was no other checks after that. And in terms of breastfeeding, you're just kind of left to your own devices. Oh. So I didn't really know what to do. And I was trying to put him on, because I did sort of think, okay, I need to try and put him on my breast, because in my mind, you know, he would just come out of the womb and then just be like ready to breastfeed. And he would latch and everything, but he just would, like I put him on my breast and he just wouldn't latch. And
how many hours passed since birth at that point?
I can't remember. I was in such a haze, like it just, and I was in so much pain from the stitches and everything, and I don't know. I think I want to say it was like all of the rest of that night and like the next morning I just was trying, because he was crying. He just kept crying, and I was like,
what did the nurses say?
I did end up I did call a nurse in, because I was like, what do I do? And she just sort of was like, oh yeah, you just try and put him on your breast. And I was like, okay. And then, but there's no milk. And she said, yeah, that'll come, you know, in a few days. But yeah, just try and put him on your breast was the advice.
They didn't help?
They didn't. No,
I think the first time they should help, right? Because you don't know how to do it.
Yeah, later I did end up speaking to an older midwife, and her English wasn't great, and obviously my German is pretty much non-existent. And she basically said to me, she did try to get his head and try to help, like get him to latch, but he just wasn't latching. And then she tried to say to me that it was because of my nipples, that like my nipples were too small or something. I was just like, I don't even know what this conversation is. This is definitely not helpful at all.
Yeah.
And yeah, so he wasn't latching, and then, which I later found out meant that because it wasn't stimulating my milk to come in, because when they're latching even before your milk comes in, it's helping to stimulate like the nipples and everything, and the
like
the milk glands.
That there should be. Yeah.
Exactly, so that then your milk will come in. Yeah, so I just found the day and a half, or was it 2 days, that I was on the maternity ward, just left to my own devices, in so much pain, and no help with the breastfeeding. Yeah, that was just a nightmare. So I just ended up saying, even though I was the one who had decided to stay in the hospital, I wanted to stay there the 3 days, because I thought, oh, well, they'll help me. I don't have family. You know, I'm in a country where I don't have family support. But I just ended up deciding, you know what, I'm just going to discharge myself, because
this is not helpful.
This is not helpful. There's a woman across from me whose baby is also crying, you know, all night. Neither of us are getting any sleep.
Stressful.
It was super stressful. And I had also asked the nurse, one of the nurses at one point, like I felt like I was bleeding a lot, like more than I should. And I was in a lot of pain. Like I still couldn't walk very well by the second day. And I remember asking her, you know, about the bleeding, was that normal, and the pain and everything. And she was just like, yeah, it's fine. I just thought, you know what, like I'd be getting better care at home. So I just went to them and just said, yeah, I want to be discharged.
What did they say?
They weren't very happy about it, because they wanted me to stay the full 3 days, because apparently
there's a test they do.
Well, there is a test, yeah, they do this first test to check the baby, which you can also get done at the pediatrician. So Matt called the pediatrician to find out if they could see Frankie, to do this first check that they do, which is just like a standard check in Germany that they do, you know, routinely at different intervals. And yeah, she could do it. So I just thought, well, we'll just take her together to do it there, and I can go home and try and get onto the breastfeeding situation. Yeah.
In a more relaxed, comfortable environment.
Right. And I had a midwife, so that's a great thing about the system here, is that you know, if you can find one, because obviously it's about the capacity, if you can find an available midwife. But yeah, I had a midwife who could come for these home visits after I was home with the baby. So I had already messaged her, and she was available to come, I think, the next day. So yeah, I went home.